Namaste. Greetings from all of us at Apollo Hospitals and welcome again to our corporate health series. This is Dr. Srinidhi Chidambaram and I hope you're all staying well. I hope you've been enjoying these sessions that we have been presenting with the goal of giving you very precise and relevant information about your health and well-being. Today, I'm going to take you through a journey that began for Apollo Hospitals in 1983, when our chairman, Dr. Pratap C. Reddy, brought world-class healthcare to India and went on to create a trailblazing presence for Apollo Hospitals across the healthcare ecosystem, from routine wellness and preventive healthcare to innovative life-saving treatment, diagnostic services, and the entire health spectrum really. Apollo Hospitals has since then touched more than 200 million lives from over 150 countries. But an unforgettable pioneering contribution that Apollo has made has been the effort to introduce what was called then as the Master Health Check. This was a set of carefully curated investigations and tests that could screen an individual for major preventable diseases. The Master Health Check proved to be an invaluable tool, and the incredible stories of people whose lives were saved thanks to timely detection and early treatment stands testimony to the power of preventive health. Like healthcare itself, the Apollo Master Health Check also has undergone constant evolution in terms of processes, protocols, services, technologies, and the tests themselves always seeking to deliver what is world-class and cutting-edge. So it has evolved today into ProHealth, which is a wonderful amalgamation of science, technology, and medicine that delivers a customized program designed for each individual. It includes many features which we will discuss in this program. And today, we are going to start right at the beginning, exploring this incredible journey of health checks in the Apollo ecosystem and in our country as well. Today, I have with me two special guests. But first, it is my absolute honor and privilege to welcome a very, very special guest, the stalwart of preventive health checks, who really implemented every bit of Chairman's vision of preventive healthcare, Dr. Udaya Balasubramaniam. Dr. Udaya is a pioneering figure in preventive healthcare with an extensive career spanning several decades. After gaining valuable international experience early in her career, she joined Dr. Pratap C. Reddy, our Chairman's Master Health Check team, way back in 1974 as a medical officer. And after the inception of Apollo Hospitals, she played a vital role as the clinical coordinator of the Master Health Check division, and over the years rose to become the Group Director of Preventive Health Services, and today she's the National Advisor of Preventive Health Services. With absolute dedication, she continues to advance the cause of preventive healthcare. Dr. Udaya ma'am, thank you so much for joining us today. I'm also delighted to welcome Dr. Srividya. Dr. Srividya is Medical Director, Preventive Health at the Apollo Hospitals Group, with 20 plus years of professional experience and 10 plus years of teaching experience. Dr. Srividya is an internist, diabetologist, women's health specialist, and has over 2 decades of enriching experience in the medical field, particularly in preventive health and women's wellness. She's played a pivotal role in Tamil Nadu's COVID-19 response and has notably contributed to several pandemic management initiatives. She's an alumna of the Mahatma Gandhi Institute of Medical Sciences with several roles at Apollo Hospitals, MGM Healthcare Chennai, Adyar Cancer Institute, and several medical colleges as well. Thank you so much for joining us here today for this very, very exciting discussion. Ma'am, let me begin by asking you, Dr. Udaya ma'am, about how it all started. You were entrusted with giving life to Chairman's vision, and you created India's first Master Health Check. So that must have been an incredibly memorable and exciting experience. Can you take us through the journey of how that happened, how that concept came about, and what was the impact on healthcare in India at that time?
Appreciate and thank you for the nice words. Namaste. This program was started by a chairman in the late 73 and the beginning 74. That's the time it was. Then I joined in the middle of 1974. That thing kind of it had taken a shape, and we had about reached 3, 4, 5 patients coming that way. And originally there was just one package that was called master headship. And chairman made it to be like it's a name of the checkup, master health checkup. I mean, unique to his own clinic. That time he was at that clinic. But the seeing that even in the nearby clinics and people started offering kind of a similar program, and also by the name master health checkup. So in order to make it unique over a period of time, it was referred to as Apollo Health Check. And then it became more like a personalized thing, so on a personalized health check. And now it's taken as a very large shape as a ProHealth.
But ma'am, what was the thought behind it, because it wasn't really so common before chairman really thought of it. People just used to go to hospitals when they were sick. So what made him think about this whole concept? You must have been part of those discussions at that time.
Look, actually, those days there was nothing like a preventive care check. The concept was not existent at all. And in fact, even somebody had to typically go on adherence for obtaining these purposes. Typically would go to exceeding one place, test with another hospital, and seeing the physician and another place. We used to have go run around and get these tests and pieces and things like that. And then that's the time like the chairman had just come back from US, and he was thinking about people who took health insurance, life insurance policies. And he, at that time, there were a lot of them that found to have certain significant findings, which knew that they had such findings at all. After coming here, he got to be thinking about it. And he said, when it can happen to the policy holders, naturally it can happen to the public. I mean, so many people are around not knowing what they have inside. So then he thought we must have a program, and he set up a small unit on the teachers, another one group. That was the first time actually any nursing home or a clinic had what the essential test. Those days which were all the existent tests. To the fusion factors, X-ray, ECG. In fact, even introduced those dates, and I suppose it was one of the very first treatments that were introduced in Chennai. So that's a physician component added to that. So that became known as a master checkup, in which, as I told you, has become a very large, huge program for the States. So his idea was particularly the early detection in an individual who was apparently normal looking and feeling normal. The very early detection, naturally, you can help them to remediate measures and get reset back to normalcy. The focus those days was more on early detection.
Dr. Srividya, as the current medical director of Apollo ProHealth, how do you view this evolution from the earlier model to today's model? What do you think about this whole journey?
At the outset, thank you very much. And it's an honor to be sitting with my mentor, with whom I started my journey as a physician 20 years back as a fresh MD. And I was one of the health check physicians those days. And I learned about preventive health with Apollo way back in 2006. So to answer your question, Dr. Srinidhi, the initial concept of trying to pick up diseases, which is like a ticking time bomb, and so that we can prevent an event or prevent complications. That is where we had started. Now, with evolution of a lot of lifestyle diseases, changes in the lifestyle, uh, running down of the ages. That means what used to happen to our grandparents at the age of 80 is happening to our parents at 60. My generation is at 40. So we are anticipating early diseases in 20s and in. So this is where we are when we talk about prevention and early screening. And we have evolved ProHealth from a simple master health check program, which it was focused on the three main NCDs of diabetes, hypertension, and heart attacks, to much more larger, with undeniable, should I say, things like sleep issues, obesity, early cancer screening. So we have evolved in the last 40 years to look at change beyond our imagination.
Right. How has this concept been received, do you think, by the people of India? Ma'am, like, how is the reaction of people at that time? And do you think that people are much more receptive and aware of how they need to take this preventive action? Or do you think that there's still some kind of reluctance about it? Actually, this question is to both of you. You can tell us how it was before and then how it is evolved.
It's those days there was hardly any awareness of internet prevention. Nobody would think of going to a hospital or a clinic just like that. Honestly, yes, they never used to go to the hospital. But ever since our chairman introduced this program, some of the particularly certain companies, he was able to convince them about the benefit of this routine screening. So some of the company executives are, then they themselves are surprised that certain conditions were detected by the hardly knew that they absolutely no symptoms that they get problems. Particularly, as you know, like sugar, blood sugar and things, blood pressure. Most of the patients, they may not produce any symptoms of the early stages. The only people with a lot of symptoms used to come to the doctor only because they already have suffering from this condition. So then they started getting convinced. And there was another segment who was ardent followers of the chairman. I mean, they just did whatever was asked by the doctor to do. So the moment chairman mentioned that the health, then we have a basic idea of what your health, and then we can proceed to find out on the diseases and treat them accordingly. This mainly followed. And this segment was also really for a surprise because they had certain elections which was not at all known. So this is all the kind of slowly the concept picked up. And as I mentioned, the other clinics and other hospitals seeing the success also I think they are looking at not really. So, they thought that it's a good way to introduce patients to the hospital, things like that. So that is how it became popular. And then over a period of time, the other features which I think of Srividya features, maybe the other features were added to the program.
So do you think, Dr. Srividya, that, people are much more proactive these days? Do you think they come without much prompting? Or do they still need a lot of prompting from their own doctors or nagging family or... Yeah.
So I think the acceptance of the common non-communicable diseases for which we started the struggle 40 years back. When I joined as a physician 20 years back, I think we were at that stage where we were ready to accept that, yes, diabetes, hypertension, and heart attacks are our reality. After that, like anytime you want them to say, okay, you need to talk about preventive cardiology or do a treadmill before you are going to get into any type of high-intensity workout and all, it is scary. People still live in a world of denial that they don't want to accept till somebody next to them drops down, and over a period of time, with a lot of celebrity developing problems, Those are the things which are being spoken much at large in the media. Acceptance that yes, at least I have to do an annual health checkup or a health screening program once in a year or once in 2 years is a norm nowadays. The issue is not getting the health check done. The issue is what do you do after that? For most corporates who are signing up with us are getting it done for their employees. But end of the day, these employees probably just take the file and the report and it remains in their cupboard. They've not again for 1 more year of checkup. It can be any hospital after that. The concept of health checkup has enlarged to so much of a spectrum, and still there is so much left to be done. Accepting that you need a screening is one part of it. Doing something about it to make a major change in your lifestyle is the second challenge. So we have reached a stage where yes, we are accepting it. And what next?
So there is this element of personalization that was brought in after a few years of the Master Health Checkup. It became the Apollo Personalized Health Check, and today it is the ProHealth. So this is an interesting concept, which I think our audience would be keen to understand where we are exactly coming from when we talk about personalization. What is personalized? Why is it important? And is this something that is very unique to what we are offering?
Personalization came around, I think, around 5-6 years back, in 40, around, it's not 10 years now. Like that. How did it last back?
Again, sharing that take it. Standard checkup, I mean, fixed 5 figures alone may not be sufficient for some people. I think you had a lot of experience and you knew what you could detect at the first time and you know what somebody else needed. That time we realized that there was a need for a personalized kind of a health check program. So to an extent, it was personalized in the sense to bring say to the right complaints to the patients and they decided them. Then they realized that they may require some more tests which may not be there, the package. So those some more tests were added to the baseline check and that as a personalized check. But then over the years, even that some of the time tests which were kept as baseline tests seem like anything people maybe with that individual may not. So we wanted to make it like a totally a personalized thing. And that is where as the one part of ProHealth is my ProHealth. Yet can tell more about
what, like man is saying, the idea of personalization came with somebody walking in and somebody taking a history and then deciding what we need to do. Or after getting a particular set of fixed package done, we realized that we need to add something more to their package. And it was time consuming, maybe cost also, and then the interpretation. So what we have done now is that we have a set of fixed questions, around 7 to 8 questions, which when answered, so it is available on all our Apollo website, on the Apollo 24/7 app. We can go there and read those questions. Once the question is done, and it can also be done after a registration. Once it's done, it pops up with suggestions saying, say for example, it is a 31-year-old male with overweight of like 100 kg, all hello. The concept that there is something, so does not have diabetes, he doesn't have hypertension, but he has obesity. But the biggest thing which will come up is that, are you snoring? How is your sleep? Are you having difficulty in weight loss? All those things. And then it will come up with a suggestion saying, okay, you don't need to do a bunch of these tests, but you need to do a lipid profile. You need to do an ultrasound abdomen to show a fatty liver. Definitely need to do a sleep study. When we go to the personalization at that extent, that is one, the micro health where it has come. We also have different set of risk scores, which is algorithm based, and it tells that a woman of 25 may not need a mammo. 40 plus or a 40 plus with a family history will need a mammo. things like that. So we have made it possible and very easy for somebody to understand. We can always go back to the unit or to their own doctors, discuss it with them, and then go ahead and do the check also.
There's also this focus on AI and utilization of data that has been gained over so many years of Apollo doing the preventive healthcare. So it is literally a culmination of what we have done and our experience over the last several decades. So would you like to tell our viewers about how we use AI and how we are using predictive kind of methods in the preventive healthcare ecosystem?
So, over 40 years of health check, I think we have EMRs, electronic medical records, for the last 10, 12, 14 years almost. And because we have discrete data, we were able to analyze the data about what is Indian ecosystem, because by and large, in today's time, the predictive risk scores are all Caucasian or American based. We do not have a population based study in India. With our AI, with AI enabled technology, we've been able to develop two very important risk scores, and then 3 of them are in the pipeline. We have found a AI based cardiovascular risk score, which predicts on the basis of 6 questions, 6 to 7 inclusions rather: family history of diabetes, height, weight, age, cardiac event, hypertension, things like that. CA1C. But TFT and the lab and diagnostics are not yet included, but this is only on the basis of history. We are able to predict a cardiovascular risk score, which tells whether this person is going to be at a risk of developing a cardiac or a cerebral event in the next 5 years, in the next 10 years. This is what the risk score means. Somebody can be low, somebody can be moderate, somebody can be high. The one thing which is very clear to us is that low risk does not mean no risk. Even if somebody is low, it's still, there is a chance that if that risk, the factors which are attributing to that risk factor is not taken care of, we will move from low to moderate. Then the chances of the event is much higher. Similarly, we have also picked up for pre-diabetes. We only talk about diabetes when it becomes symptomatic, when the blood sugar and HbA1cs are very, very high. There is a section of diabetes which is called as pre-diabetes, which is HbA1c less than 6.4. 5.7 to 6.4 is pretty much ignored, saying it is borderline. The idea that this pre-diabetes is something in today's time which can be reversed. So we have in AI-based the pre-diabetes risk score, which on the basis again of history and their lab finding tells that you have chances of developing a pre-diabetes, forget diabetes. We are telling you you're going to be pre-diabetic now. The other 3 things which are in the pipeline is a liver cirrhosis score, a kidney score, and a COPD score. So depending, this will all is based on history mostly, which will predict the chances of developing a cardiovascular complication, a liver complication, or a renal complication, or a lung. So this is where we are using AI to make it friendly. Even instead of fighting AI-enabled medical or healthcare, where we are worried that AI is going to take over, we at Apollo, with amazing insight from our leadership, have done this and brought out one of the most unique features of the cardiovascular system in India, which is the AI CBD, which we are at, as we speak, getting it validated by physicians and cardiologists across India.
Right. Also, I just wanted to ask both of you really about what I don't think we also stop just at doing the tests, telling them what it is, and then sending them off with a report. So the element of follow-up is has always been an integral part of the health check system. But how has it been refined further now?
Yes. Yeah, I mean, this is well, as you yourself said, that it's not just stopping with the health checkup and just detecting the conditions and the advice. Even those days in the beginning days, they get extra given bigger issues. But how many really for advice they get no? The very sure was done up when you tell them in compatibility days, or you compare how to get from looking at checkup because you have a family history. And when you mention like, how many people used to come? But still here there is an element for but it's once the data is entered on the system, there is a PHOP help meters they are called. Beyond what that we can all the important findings. They are provided with the dashboard on which they know the economic findings. And they all the patients just quarter periodically according to the severity of the condition. And then we are sacraments to mice more than severe in once month or once in 6 months. And reminded of what we are expected to go, find out all it's in case they had done in the wrong place and current and all what is they should do about it, or that they should come back for physician consultation. And the team would also enable fixing an appointment with the consultations. So at least for a minimum of 1 year for that, the antibiotic is an MFP, no stop. But I really not just let's stop and check the all those and then we put on starts wellness. So that's most important component of the ProHealth.
So what happens is that once the ProHealth check is done and all the data entered, the prescription entered, there's a finalization of the summary and the physician end. This data flows into what we call as a health metadata dashboard, in which depending on the severity of the illness, they are categorized. Depending on the severity, whether they're mild, moderate, severe, every month or every week, a message on WhatsApp message, a nudge, or a call is being done by the health mentors. These health mentors also interact with the guest about the type of diet they are following. When do they have to do a follow-up test? Have you done a repeat HbA1c? Even if the HbA1c and tests are done outside the Apollo ecosystem, we are provisioned to enter it in our system so that a trend is formed. So at any given point of time, if somebody has done a health check with us for 2 consecutive years, we have a trend. And we can see, we have seen that almost 50 to 60% of improvement in cholesterol level, in weight improvement, weight loss, in better sugar control, in picking up of early cardiac event has been very, very beautifully achieved by these health mentors. Our health mentors are either a nutritionist or a physiotherapist, and we are bringing in the concept of lifestyle medicine experts, right?
I should have invited us in so that you got reminded about the date of the health check. Otherwise, it used to go on only when they felt like they remembered it used to come. So this thinking out stuff it is sending that and thought of lunches will be sent periodically. So that they are reminded of what we are expected to do. Here, before concluding, I was this whole momentum or happened only because when Chairman had the feeling that initially it was like he saw an observation that the cities were increasing in number, was large numbers. In fact, there was not much talk about it in the media or anywhere about the India's also becoming and fast becoming impacted of the pace of these diseases. And when this concept, when he introduced the enhanced or the people Just then started to realize, oh, okay, what when I questions it is very new. We are seeing for ourselves the number of heart diseases in India, diabetes in India. And moreover, one of the main triggers was somebody in the family, any calamity, immediately they think of it. So that is the awareness of AZ in general, and speaking about having to play a lead role in controlling NCDs and helping the people, suddenly increase the team size. It was a small team which was anti-distant checkup, just 3 or 4 members. When he said that it should be spread across country and even globally. So that way, with a large team must be set up now so that the focus is given a lot more on the NCD control now. So it's more from one economic point of view also, that is concerned very many.
Let me conclude by asking you what you think is there in the pipeline in the future. Like, Dr. Srividya did mention a few things, but what is the future of preventive health? Do you see more and more of technology coming into it, or what is going to happen in the coming years?
I think it will be a very beautiful amalgamation of medicine and technology, both, Dr. Srinidhi. I really don't think we can not embrace the technology which is being offered to us and not use it, right? So, for example, we've realized that asymptomatic health checks, we do not really need to do a fasting, overnight fasting, make our senior citizen come empty stomach. So we are at the helm of rolling out non-fasting protocols and using the interpretive power of diagnosing diabetes, cholesterol, and fatty liver and all to our physicians. They are trained to do it. We are also using MRI and CT for early cancer screening. These are protocols which we have set up for our guests. And it does not have, because so many times we realize that our family members, they were asymptomatic and they have picked up a malignancy and they come for a health check. They're asymptomatic there. That was the thing. If you are asymptomatic and we are able to pick up a chronic disease the earliest, we are preventing a huge complication and we are using technology at its best. So the idea of early screening, trying to get a lot of Indian data, mapping various disease factors or various NCDs like insomnia and obesity to cancer, insomnia and obesity to cardiac events and cerebral events, neurovascular events. One of the best ways to do it is to use the technology which we are given, both IT and AI. That is going to be our future.
So thank you once again to both of you, Dr. Udaya ma'am and Dr. Srividya, for giving us this overall perspective and journey of preventive healthcare. The journey of Apollo has literally been the journey of our country as well. So I would urge our viewers to understand the importance of preventive healthcare and ensure that you do get your health checks done. Of course, lifestyle is all important, eating healthy, getting active, sleeping well, keep moving, staying at a healthy weight, quitting smoking and other addictions, managing stress. But then, apart from all this, there is also this extremely powerful action that you will need to take that will keep your health at its peak and add to your productivity, success, happiness exponentially. And that is the Preventive Health Program. Choose the program that will really help you to attain your peak health. The human body is a masterpiece of evolution, billions of years in the making. It's a testament to life's infinite possibilities. So do take care of your body. Thank you and see you again soon. Namaste.